Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. We always try to bring to you information that comes from you, the listeners. And there's been a great number of communications relative to something called Parkinson's disease. And I thought it would be very, very interesting for you to hear from a person by the name of Beth Elgort, who is involved with an organization and deals with the Mind, Music, Movement Foundation for Neurological Disorders, Inc., which is a not-for-profit entity. And we did do a show recently with some folks doing some research from the University of Miami. What happens when we have someone in our family or associated with us that has Parkinson's? So let me introduce to you again Beth Elgort, and she is one of the founders of the Movement Foundation for Neurological Disorders. Welcome.
Thank you, Dr. Lippman. Thank you for having me. I'm excited to share our story and hope that we can help many people through doing interviews like this.
Well, it's all yours.
Okay. My husband and I moved to Florida 8 years ago after he was diagnosed with Parkinson's. And I really had a difficult time finding resources locally that would have a continuity of care. And my background is social work. I had a private practice in Manhattan and ran a program for child and adolescent psych in an inpatient hospital setting. So I was well aware of how to navigate and find the resources necessary to help one person live well, hopefully, with a neurodegenerative disease. And I set myself forth on a mission, not just to help my husband, but to help many people living with Parkinson's, Alzheimer's, dementia, even stroke, people that have aphasia, and developed a program that was not the answer, of course. We're moving forward towards a cure now, being in Jupiter and having, I called the hub and the cutting edge of neuroscience at our fingertips to, along with the research and along with the physicians, develop a program that we could integrate and have a continuity of care to helping people live well with a neurodegenerative disease. So I set forth developing a program and starting with a chorus, because we know singing can improve your vocal cord, your projection, memory. There's the advantage of having music in anybody's life is just positive and wonderful.
Well, go ahead. I'm sorry.
So we started with the chorus, and we did an event at Scripps Research at the time. That was 3.5 years ago. And the response was overwhelming. There had been 15 people the year before at a symposium at Scripps, and we had over 300 people overflow going into the classrooms. And that was it. That was it for me. I was committed to saying, I need to develop this program. I need to help people besides my husband have this quality of life. And the most amazing and beneficial part to our program is the friendship, the socialization, and having people come out of their homes and into a place where they felt cared for and could benefit from the different classes that we now offer. So it's been an exciting 4 years developing this and seeing how we have improved the lives of people living with a neurodegenerative disease. The bulk of our clients, I would say, have Parkinson's, but we have people with dementia, people with Alzheimer's. We're developing the course now to incorporate the Giving Voice, which is another chorus that's worldwide. And we hope to continue to grow. I'm happy to say that we have a wonderful affiliation with FAU, and they are supporting our work. We are starting classes as of today. After I leave you, I'm running to our first day at the Stiles Nicholson Brain Institute for, we will be there 2 days a week and hopefully spread our wings throughout Florida, because there's a need. And the value of these alternative therapies, I'll say, is paramount.
Let me ask you this. Not to get into the politics of it, but the associate dean for research from FAU is now heading up our research venue here and at Nova Southeastern University. But we have, and I think in a conversation we had, to make you aware of the fact that we have one of the, not only America's, but one of the world's leading researchers in immunosuppressive diseases. And she's working on the issue of what your venture is all about. I mean, she's talking from a research perspective. And also there is a clinic here that deals with people with Parkinson's. I admire your willingness and your love and your kindness as a human being to bring the human spirit to the individuals that are affected by these diseases. And it is, as you mentioned, it isn't just Parkinson's.
It's not just Parkinson's. And then as you know, the comorbidity with depression and anxiety, it's and every individual is different. There's not, you can't fingerprint this and say one symptom is the same for the next. Someone once said to me, if you meet a person with Parkinson's for the first time, you meet a person with Parkinson's. So it's really having an awareness, and by meeting with you today was wonderful for me to really, we want to get the message out there how important this work is, and be able to introduce it to your school. We are very involved with Palm Health. They've been a wonderful friend to us, and we are part of the Neuro Arts Initiative that's happening in South Florida as well, which is also very exciting from the blueprint. We hope to do more work and spread the word through the Neuro Arts Initiative, as well as the work that we do, being live and present and here for people, which I think is so crucial with any of these diseases because of the isolation and the caregiving aspect. It's so important.
Well, you know, the interesting thing about this, even though it sounds remote from our conversation, but the interesting thing about isolation, I think if there's anything valuable out of this horrible COVID crisis that we've just come through, it's going to be the understanding of what isolation has done to certain individuals. We hear about all the mental health, everything, everybody's, this one is shot, this one has an accident, this one has that, and they all say it's mental health. But mental health's been with us since, the birth of mankind, and womankind, obviously. But, the bottom line is that we're at a point where it's as horrible as COVID was, the value is that there's a foci now on the issue of being alone, of feeling that no one cares about me. Do you see that?
Oh, of course. I mean, I have to say it's funny how life, we can say you make lemonade out of lemons. We started this foundation, and as we were about to launch, COVID came. And my partner, May Fox, who's my right arm in this foundation, um, we looked at each other via Zoom because she's in New York. And I said, how are we going to do this now? What are we going to do? So I said, we're going to just make lemonade out of lemons and start having classes virtually. And that's how M3F, My Music Movement Foundation for Neurological Disorders, came evolved. And we made it happen. So all of our classes were on Zoom. But as you know, and I'm sure everyone around the world can agree, it 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 gets old, even for children who are in school, not having that stimulation and the real socialization. So people were asking us, can we come back now? Can we come back? And of course, we had to follow the guidelines. We were very strict about it. And we began to have classes at the Tropical Sands Christian Church on Burns Road in Palm Beach Gardens. And happy to say that we've been up and running for 3.5 years, and hope to do a lot more than just what we're doing right now.
By the way, mentioning Palm Beach Gardens, you know, there's a building right there at the Turnpike and Military Road, which houses our nursing program and our pharmacy program. So, yes, that building that you might pass every once in a while when you go, right? It's that building to your right as you're going west. You might want to walk in there and talk to some of the individuals, because particularly in the various elements of the nursing program, because we do have an actual clinic there as well, that you might want to make yourself, make them aware of what you're doing and what you could do together. So it's right there, waiting.
Thank you, I will.
Waiting for you to just knock on the door.
I am gonna walk in and knock on that door. And if you have someone I can knock on their door too, you'll let me know that.
We'll let you know, okay?
Thank you, I'd appreciate it.
We've been doing these broadcasts now, television broadcasts, for close to 24 years. And the questions really come from the viewers. And one of the reasons why we wanted to get someone here on today to talk about Parkinson's, and really it's a lot more than Parkinson's, but it's Parkinson's is where you come from. That's how you got into this situation. But Parkinson's, the belief of the questions come in, well, I'm getting older, and my hands are shaking, and I don't know, and whatever. Then they say I have Parkinson's, and I can't remember something, and I don't know whether I have Alzheimer's or whether I have Parkinson's. These are the type of questions that come from viewers. But the reality is that the knowledge and educational capacity is very, very limited to John Q. Citizen. I'm going to ask you, is Parkinson's, is it related specifically to elderly, or is it go the whole spectrum?
Oh, no. There's early onset Parkinson's that young people like Michael J. Fox was diagnosed extremely young. And it can affect anyone. Now with all of the new research and genetic testing and Michael J. Fox's stronghold to really trying to dig into the research end of things, we're getting more answers every single day. But you know, it's affecting. There are 64,000 people in Florida living with Parkinson's right now. There are 1 million people in the country. That number is going to probably go up by 2020, another 13%, let's say. I believe that was from the NIH. And right, cognitive decline is 13.6% right here in Florida. So, as far as speaking to your diagnosis, I will give you my personal story with my husband. We were living in New York and I noticed something wasn't right, but I couldn't put my finger on it. And I called our internist who said, okay, I think you need to see a neurologist. He said, walk down the hall, touch your nose, you have Parkinson's, call me in 6 months. Well, that didn't sit well with a social worker from New York. I was not happy. So I said, how do you say this to someone? How do you just say, walk down and here's a pamphlet and call me in 6 months? We were devastated. Many tears were shed. And as I do this work, I hear this story from so many people that they're told that they have this disease and see you later, alligator, so to speak. And that doesn't sit well with me. You can't, if I do anything with this work, the one thing I hope in my background is to teach humanism to physicians and nurses, that this is a debilitating degenerative disease. There is no cure at this time. You have to embrace not just the person who was diagnosed, but the family. It's a tough call, and it's like bringing in the troops. It takes a village to help people living with these diseases. So I am on a mission to make that happen, little by little. I'm grassroots. We desperately need funding. We'd like to have a home that we could say is ours and build a center that would house a physical therapist, would house a occupational therapist and a voice therapist, and have all our classes and massage therapy and acupuncture. We believe in all these modalities, but not have it as a medical setting, more as a come, you're welcome, come spend the day with us and let's embrace you. Let's embrace your family. Let's have support services. We have some groups now and we hope to expand that part of our programming with nutrition, with different music therapies as well. So, we haven't touched, we're half of what I know we can do and what is needed to help people to live well while living with these diseases. And clearly the doctors, in my opinion, still in this day and age need to learn the humanity side of treating a client, a patient. And I'm happy to say that right now we will have some high school students volunteering with us that are interested in going into medicine through the honors high school at FAU. So I'm very excited about that. I think all this work is important. We clearly know the value of improving one's mental health while you're battling any disease, whether it's cancer, whether it's Parkinson's. It's so important, and not just for the person going through it. We're also talking about a family and educating.
Every profession that you mentioned is sitting here in Davie and in 4 other places in the state of Florida. We are in Jacksonville, we are in Orlando, we're in Palm Beach, we're in Fort Myers, we're in Tampa. The dean of our College of Osteopathic Medicine, Dr. Elaine Wallace, always starts out with a brand new class and says the issue of why we're different is that we not only teach you the art of medicine, but we teach you mind, body, and spirit and how it affects the art of medicine. We're down, believe it or not, we're down to the last 5 minutes of the show, so I want to give you the next 3 minutes to say whatever you want. If you have an address or a phone number, we're glad to have it. If some people feel obliged to help you out, that's up to them. We don't do any fundraising here, but go right ahead.
Thank you so much. It really was an honor to meet you and hear what you're doing. I would like to learn more. I'd like to come and visit. Our website is m3f like Frank.org. All the information about us is there and present if you feel inclined to make a donation or to get involved with us. We love volunteers. We love knowledge. We look for people to guest speak as well, and would love to have you involved with us. So thank you so much.
I always tell you that if something's bothering you, whatever it is, don't just go to a supermarket or a pharmacy and say, oh, geez, there's something wrong with this, or I'll put my hands shaking, or I can't remember something, or whatever, you take a nutrient or whatever. Talk to your doctors. Talk to your doctors. And make them aware of the fact that they have to listen to what you're saying. And I know they are. So a lot of your direction is self-appointed direction. So I'm asking you to please don't keep it a secret between you, your family, or otherwise. Talk to your physicians. Get to the organizations. If you feel that you're not getting the answer from one, go to another one. Find out, all right? Don't sit there.
I have to add to that for 1 second. I think the biggest message we can say together is you need to be your own advocate for your health. And that is the name of the game now. You have to advocate 100% and let your doctor know, let your family know, and don't be afraid. We are here to help support the community. I give people my cell number if they have a question to reach out and ask it. Don't be afraid. So I appreciate what you just said. That was wonderful. Thank you so much.
Right on target. But I will tell you that, we have a lot of folks that are beyond the age of 70 that live in our area. And they come from a different generation of healthcare. And they'll, you can ask, but you sometimes you have to push a little harder. That's all. Don't take the oversimplistic answer like you mentioned about walking up the hall. Folks, this show is your show. If you have any questions or questions, if you want answers, there's a telephone number and an email address. Remember, this show is called Dateline Health. My name is Fred Lippman. Until next time, see you.